Well, the Hospital Association of South Africa is hosting an exhibition on the advances made over the years in medical care at Century City in Cape Town. Policymakers, NGOs and nursing professionals are among those attending. But for more, we now bring in our reporter, Vanessa Poonah. Vanessa, a good morning to you. So what really is the purpose of this visit, and who have you seen in attendance this morning?
Yes, a very warm good morning to you. And I think it's safe to say that healthcare professionals from various disciplines are here today. Apologies, we've just had a second of what seems to be load shedding. Of course, yes, as I was saying, hospital representatives, nurses, doctors, administrators, policymakers are all gathering here at Century City Conference Centre today for the annual South African Hospital Association Conference. And of course, I'm joined now by the CEO, Mr. Dumisani Bomela, who's going to speak to us about the themes of this year's conference, which will be discussed. I know that, for example, issues around the implementation of the NHI post-COVID. I know that we were talking about the kind of challenges facing healthcare in South Africa. I know for a long time there's been concerns around the exodus of nursing staff, for example. But let me bring in Mr. Bomela here now. Sir, very warm good day to you, Mr. CEO. This conference, let us start with the aim of this conference. You have it every year. We know that the South African Hospital Association represents most of the private healthcare facilities in South Africa. Talk to us a bit about the aims of a conference like this.
Good morning, Vanessa. Thank you for having us. We really appreciate that. So this is our annual conference, as you have mentioned, that we stage every year. And it comes at a time of a lot of excitement, some exciting possibilities in healthcare, whether at a time that we see everyone talking about the possibilities of expanding healthcare, increasing access to a broader society, and we also have the changes that have already started in terms of the health reforms that we see in the country. So the conference is happening at that time. And if you look at the theme, it's talking about see possibilities, collaborate. There's never been a better time to collaborate, to find solutions to the South African health care challenges than there are now. And therefore, if you look at the themes that we're covering at the conference, first of all, there is an overarching theme of sustainability. And we carry that theme because we're looking for sustainable healthcare solutions in the country. And this conference is about solutions. It's about healthcare access. How do we expand it? And what are the possibilities around that? So to tie up the theme of the conference with what is actually happening around the country, it is a big issue for us. The need to look at sustainable healthcare solutions.
I know the word innovation has also popped up, sir. In terms of the innovations at what has already been achieved in healthcare in South Africa, I suppose that will also come under discussion here over the next 2 days.
And you will see that, of course, in the program that we have, because there is a whole slot, a whole session that talks about innovation, especially technological innovations, artificial intelligence. As we all know now, we live in this 21st century where as an enabler, innovation is the thing, and we couldn't miss the opportunity to actually put it out there and see what is the latest in terms of those innovations. It's part and part of our lives, and it will be part and parcel of the solutions for healthcare.
I spoke earlier on about the delegates here at this conference, and this is just the final question to wrap up. I was right in saying that there will be medical professions from all disciplines, and of course not just from South Africa, but all coming in and sharing that input, also perhaps from an African perspective?
Of course, we have a very broad audience, and that is deliberate. If you look at the program for the conference, it is attractive to a wide range of stakeholders, both in private and public health care, because we see the solutions that I spoke to earlier on as being executed by collaboration between public and private stakeholders. And within the private sector fraternity, we've gone very wide. We're looking at funders of healthcare, the medical schemes. We're looking at pharma. We're looking at all other leaders that we think are going to be required for this collaboration to take place.
So thank you so much for your time. I know you have a busy 2 days ahead of you, Mr. Dumisani Bomela. They're, of course, the CEO of the South African Hospitals Association, just really giving us an overview this morning of the conference which got underway just now, also talking about sustainable healthcare, talking about innovation in the health space, and then also talking about collaboration between the public and private healthcare sector. And, of course, a little later on, we'll be catching up with some of the other speakers and people that will be delivering sessions here at this conference. It is scheduled to take place over the next 2 days, and also an exhibition. So we'll be going around to some of these various stalls to see what is on display, and also the kinds of innovations and offerings in healthcare that currently are available, and then also looking at what the CEO was talking about in terms of the progress, the innovation, the AI, for example, in healthcare. Those are all very interesting exhibitions that we hope to have a look at over the course of this day.